Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing today?
Doing quite well. Thank you.
Thank you for joining us all the way from Paris, France. Our viewers will know Dr. Robert Murphy as the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines and US COVID statistics through today, March 21st. We invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the updated COVID statistics from this week. Average new hospitalizations per day, 1,913. In 2023, the same week, we saw 2,887. Average COVID deaths per day, 127. Same week in 2023, 284. New vaccine uptake for adults, 22.6%, those 65 plus, 42.4%, and children, 13.5%. Your reaction to those numbers, Dr. Murphy?
Well, as before, the numbers are sort of sliding slowly downward, but there's still 127 people dying per day. That's 46,355 people per year. That's still a lot. So, I mean, put it into perspective. This is a nasty disease. And if you're at all at risk, of course, your chances of having a bad outcome here are greater. But you know, it's good to see that the winter uptick is kind of coming down, which we expected by the end of March. This is very predictable. So in April, it should come down significantly more in May. And then we'll just hit this, equilibrium. But remember, we've had summer outbreaks too. So COVID is a little different from flu. Flu is a winter disease, but COVID can happen anytime. But it just means that you've got to keep up with your vaccinations.
Mm-hmm. And speaking of those vaccinations, we had a question from a viewer this week who is in their late 60s and has some underlying health issues. They, last October, received their flu vaccine, their RSV vaccine, and their COVID vaccine. They're completely up to date. They are a little confused about the new CDC recommendations for the spring COVID booster. Do you recommend another COVID vaccine at this time, even though it's only been about 5 months? And should they look into getting either one of those vaccines, if so?
Yeah, this is a really great question and an important question. And there's no really right or wrong answer. This person is up to date on their vaccines. They're doing great. RSV, high dose flu, the most recent COVID vaccine. If they get a vaccine now, it's the same vaccine they took 6 months ago. And that is really what the recommendation is. Now, the thing is, in 6 months, there's going to be a new vaccine. It's going to be an updated vaccine. And should you wait or not? This person is high risk because they're over 65. This person also has underlying health issues, but they're controlled. There's no right or wrong answer here. If you followed the guidelines strictly, you would take another of the vaccines right now. And that could be any one of them, Moderna, Novavax, or Pfizer. Doesn't make any difference. But a lot of people are waiting for the next vaccine before they get updated. And it's really a decision between you and your doctor. There's no right or wrong answer. If you're tolerating the vaccines well, you should probably go ahead and get the vaccine. But if you've had some, side effects with the vaccine. You don't think you want to wait a little bit. You could wait the 6 months, but then get that vaccine right away when it comes out.
Mhm.
So no right or wrong. Great question. You can go either way. But this person has the risk factors mounting up. So the underlying disease over 65 probably be better to take it. But it's there's no right or wrong answer here because I've seen people go either way.
Mhm. And while booster shots throughout the pandemic and now after the public health emergency have been recommended in extra doses for those who are immunocompromised, can you
Mhm.
explain a little bit why the CDC is recommending another shot now for people over 65?
Well, I mean, if you look at who's ending up in the hospital, these are the people that are ending up in the hospital. And like I just said, 127 people are dying per day, 46,000 per year. So, over 65, underlying disease, um, that's basically why they're recommending it, because they're seeing who are these 127 people per day. That's the whole issue here. So, you will get more protection.
Mhm.
If you had a lot of side effects from the vaccine, I mean, a lot of people, that's why they're putting it off. But if you're tolerating these vaccines, that's fine. And you want to switch to the Novavax or the switch Moderna and Pfizer, that's okay too. Matter of fact, it might even be better for you. It also depends whether you've had COVID recently, because if you've had COVID, you have hybrid protection. So you have the COVID that caused an immune response, and you have the vaccine. So there's a couple things come into play here, but that's what's really going on, and it's a really good question. I wish I had a perfect answer, but you can't go wrong here.
Mhm. Now, we are just over 4 years exactly from when COVID-19 was declared a public health emergency. Can you just delve into some of the ways that COVID has reshaped life for many people here in America and around the world?
Well, it's definitely changed the world, and it looks like the world is not going back to the way it was in 2019. The whole hybrid work style with people doing these kind of meetings on Zoom and not traveling as much. Although the airplanes seem to be pretty full, but the business class, the people traveling for work is still down. And that's because, traveling is expensive. And I came over here because I had some meetings in Mali, West Africa, and in South Africa. And the business class was not full. And of course, it's winter, or North American winter, but it was not full, and the fares were significantly discounted from what I'm used to seeing in this kind of travel. So something weird is going on that's palpable. The suburbs are booming. People are back to the suburbs, and because they want more space, because they're working at home is a lot. So it's changed the whole urban suburban kind of lifestyle. And because people still need all the same things, they still go out to lunch, they still go out for dinner and for entertainment and whatever. And downtown is hurting. If especially Mondays and Fridays, what some of the people are telling me from Metra and CTA, the ridership is still down. So, that has a huge impact on the businesses that service those people that were going to work 5 days a week. So it's not like it's not happening, but it's not happening in the same places as before. So it's definitely changed people's lifestyle. And I think it looks like it's going to be permanent. And there's going to be some major, just a major change in how we're dealing with COVID and all these infections.
Mhm. Now, switching gears a little bit to measles, which we've been talking about a lot lately, we had another submitted question from a viewer who had measles as a child. They, in school remember seeing the long lines of children getting vaccinated, They did not, as they had measles, and are wondering, as an adult, do they need to get vaccinated?
Well, okay, unlike COVID, where the immunity wanes significantly with time with everybody, measles, that doesn't happen. You got the immunity, you got it for the rest of your life. So if you had measles as a kid, and that includes every single person born before 1957, because back then everybody got it's so contagious, everybody had measles. It's just assumed you had measles. But if you remember even getting a shot, a measles vaccine, whatever, that lasts forever. That's not the problem. The problem right now is that there are too many people that did not have measles and didn't get a vaccine. And it's from the people that don't want vaccines, but it's also people coming internationally from places where the vaccines are not that available. It's just they didn't never got vaccinated. Um, and uh, and that's where it's coming from. I mean, measles was almost eradicated in 2000 in the United States. And now, we have, I think it's 58 cases reported for this year alone, which is as many as we had in all of 2023. Now you say 58 cases, the whole United States with, over 330 million people. That's not that much. But this is, measles can be a dangerous disease. People can die from measles. It's not common, but it can happen. They get encephalitis, and it can be a very debilitating disease. But the important thing is it's so contagious.
Mhm.
Going to spread.
And yeah, it spreads a lot and very
This
quickly.
person doesn't have a problem. This is not the person who's going to get measles.
Absolutely.
Good
And
question. You have to realize that if you've been vaccinated or you had measles, you're never going to get it again.
well, that is very good news. And thank you for the question. Now, you touched on it a bit here, the 58 measles cases. Can you delve a little bit into that and give us a broad update?
Yeah. So Chicago has 15 cases, so that's a lot. Um, uh, 10 of the 15 cases came from the migrant shelter in the Pilsen community. Um, and they're quarantining people there, they're vaccinating people there, and that's exactly what they have to do to get this thing under control. So I know that the CDC has sent people to help the Chicago Health Department, but they're doing exactly what they have to do. The health department is on top of it, and they're taking care of this the best they can. And it's it's going to be a little bit tough, but once everyone's vaccinated, it should be okay.
Mhm. And there have been situations around the country with lots of people getting exposed. In those events, we're
Mhm.
lucky that a lot of those people were hopefully vaccinated. For one example, there was a big exposure in California. Can you break down that a little bit?
Yeah, so in California and many other places, in California, though, they reported that 300 people got exposed after a young kid came to the emergency room at UC Davis in Sacramento, who was confirmed to have measles. So the point is, if you think you have measles, you have rash, fever, you look sick, call the health department. They will they will come and evaluate you before you go expose another 300 people in the emergency room.
Mhm.
And so that's the thing you're supposed to do now. If you can figure out how to get through into the health department, but you know, all the major health departments have hotlines for stuff like that. And it's better, or if you have a pediatrician or a clinic, somebody you're working with in the healthcare field, they'll tell you what to do. And what they're going to tell you is don't go into the emergency room. Now, if a person's not breathing, or I mean, there's something terrible, slap a mask on and go. But I mean, you just don't want to expose all those people in the emergency area. 300 cases in this one thing. It's so contagious. So you just have to be a little bit careful.
Mhm. Now, taking a little step back towards respiratory viruses, just a quick flu update. As COVID indicators, as you noted, have started to go down, how is the flu doing?
Flu's still bouncing around, and some of the places it's even increased as COVID has gone down. So the people are getting flu. So that's still a problem. So people have to be careful. And the uptake of the flu vaccine, I think you mentioned it, is only about 50% and 73.8% in people 65 and older, and children 51.4%. Uh, those are not high enough numbers. Now, flu is not as severe as COVID. COVID is worse. But it's very important to stay up to date with your flu vaccines. There's been already this year 116 children have died from flu. Probably most of them preventable if they had been vaccinated. So
Which is very unfortunate.
it's still going.
Mhm. We will keep an eye on those indicators and keep you updated.
Mhm.
But something that we haven't talked about a lot in the US is tuberculosis. There's
Mhm.
reports out of California about increases in cases after the pandemic. Can you break that down for us?
Yeah, so in 2023, the state of California had reported a 15% increase in tuberculosis. They got up to like 2,100 cases, and it had been 1,800 or so. So TB is bad. It's life-threatening. It often gets missed because you don't think, oh, who gets tuberculosis in the United States? Well, about 8,300 people per year get tuberculosis. Now, a lot of them are imported from other countries, but they expose other people. TB it's the number one killer infectious disease in many areas. In places in low and middle income countries where it's highly endemic. I mean, like it's just rampant. So, we just have to keep an eye on tuberculosis, has to be suspected, in emergency departments and clinicians that, TB is still around and it's increasing. Now, one reason it's increasing is that during the COVID pandemic, with all the mitigations in place, all the infectious diseases went down. Flu went down to almost nothing. But everything went down, TB and RSV. So, and now you're getting kind of a return to normal
Mhm.
bad numbers.
Yeah. Finishing off today, an infectious disease we've been talking about a lot because of how big, unfortunately, it has been in the year of 2024. Can you break down the state of the dengue outbreak as it stands?
Yeah, dengue is just going crazy in the southern hemisphere. So it's transmitted by mosquitoes. Um, 20 to 25% of people who test positive get sick, and a lot of people get seriously ill, and people can die from it. So Brazil has been hit particularly hard. 17 cities have declared a state of emergency regarding dengue, and they've reported more than 1.5 million cases. That's a lot. The emergency rooms and clinics are overwhelmed. It's the seventh worst outbreak since the year 2000. Um, and it's really terrible. So they have some vaccines, not available here, but down there. And they have vaccines to fully vaccinate only 3.3 million people, and there's 220 million people. So they're making their own vaccine now, and it's going to be cheaper and hopefully as effective. And but that's not going to be ramped up for a while. So right now it's just being swamped. So they're not the only country in trouble. Peru declared a health emergency across the entire country. Paraguay registered over 100,000 cases, which was 5 times the typical number for that country. So, I mean, I think for us, I mean, they're dealing with it. They understand it. Dengue's been down there for a while. And, but if you're traveling, if you are going to South America or something, you have to be careful about getting dengue. And this includes the Caribbean too.
Mhm. And of course, if you are traveling internationally, make sure to take advantage of our government's resources and the CDC's resources for safe travel. Always very important. But on that note, Thank you, Dr. Murphy, for your time and expertise, breaking down the headlines, the statistics, and answering our viewers' questions. It's much appreciated.
Well, thank you.
And thank you all for joining us again this week. If you have any questions, please leave them down below as a comment or at any of our social medias linked in the description. Have an excellent weekend.
Have a great weekend.